It's Enrique Guzmán van Dyken, and this morning I actually took my last final for the year, so I'm officially a second-year medical student. So I'd like to thank the Equality Scholarship Collaborative for this award in recognition of my work serving the underserved LGBT community for the past decade here in San Francisco. And I can't remember a time since graduating from high school where I wasn't working to pay for my tuition. So when I started medical school, I plan to continue doing the same to help cover my expenses and pay for school. People warned me that I wouldn't be able to and equated attending medical school to drinking water out of a fire hose. Unfortunately, they weren't kidding. I do find myself drinking water out of this fire hose constantly, and it is pretty intense. So the financial assistance provided by this award will cover a significant portion of the high costs of my medical school expenses, and it'll give me more peace of mind to just be able to continue focusing on my demanding studies without just thinking about how much student debt I'm accruing. I'm an immigrant from a rural, low-income, and medically underserved community in Jalisco, Mexico. From an early age, I wanted to become a doctor and help serve underserved communities like mine. And after college, I wasn't ready to apply to medical school right away, so I decided to temporarily work at a community health center helping low-income LGBT Latino immigrants like myself in the field of HIV prevention and HIV care. This temporary position turned into a 7-year commitment where I served individuals at risk for HIV as an administrator and as an HIV testing counselor. While working in the field of HIV, one of the biggest challenges that our clients faced was finding appropriate housing, especially here in San Francisco. So I devoted the next 3 years to helping HIV-positive individuals find appropriate housing and also providing permanent supportive housing for homeless individuals with complex medical and psychiatric issues, a large percentage of whom are members of our LGBT community. Housing is healthcare. A lot of people don't think of it that way, but it is. And in a housing market like San Francisco's, it's not always conducive to find that appropriate housing for many members of our community. So I was happy to help these individuals improve their health outcomes with these interventions. While these experiences were extremely rewarding and really helped me grow tremendously as a public health professional, my true passion, medicine, drew me back to medical school earlier this last year. And it'll keep me busy for the next 3 years, but after finishing medical school, I plan to return to San Francisco, my adoptive home, and I plan to serve the LGBT community in my capacity as a physician. I also plan to work on ensuring that other healthcare providers are trained and able to provide members of our LGBT community with medical services that are sensitive to their respective preferences and medical and psychiatric needs. Thank you.